So maybe, Beth, you can tell us a little bit about what attracted you to the MASc in creative health and your background.
Oh gosh, there was lots of things, Helen, that attracted me to the course. I think one of the really big things for me was the interdisciplinary nature of it. Coming from a performance arts background and being interested in how my work can kind of help people improve their own well-being, I kind of saw this program as a chance to kind of further develop my ideas around how I can use my practice to best improve my participants' well-being. And I also, the dissertation project was a really big selling point for me because I'm a massive research nerd. And the idea of being able to go out into the community and work with an already existing organisation on a research project that they are interested in and kind of wanting to develop was something that really interested me as someone who kind of didn't really have much research experience kind of coming into this programme. So yeah, I think those are the two big points for me.
And why don't you tell us a little bit about what you've been doing before the MASc? What kind of work?
So I graduated from the Royal Central School of Speech and Drama just before I came here with a BA in Drama, Applied Theatre and Education, which is essentially using drama in the community to kind of look at how we can kind of improve wellbeing to an extent. I then specialised in arts for dementia work, working with a bunch of different organisations and different practitioners, kind of looking at how we can use arts in hospitals to kind of help with cognitive stimulation and the wellbeing elements of people living with dementia, and looking at how the arts can kind of enable people to tell their own stories and how they can kind of help give them a space to kind of be human in an environment that can be quite dehumanizing at points.
So you actually had quite a bit of a background already in some of the things we do in creative health, which I think is not unusual. I was thinking about the other students in the cohort that they come for very good reasons, right? And they have a background. But since you started with us, then what has been the highlights of doing this, or are there particular important elements of the program so far? We're about halfway through it now. So what would you highlight as having been helpful in further developing your practice?
Oh, for sure, the lived experience module. I really, really, really enjoyed that. I think it's been so interesting to kind of sit and listen to external practitioners come in and talk about how they use the arts to kind of help their participants' well-being or help their own well-being. So I've really, really loved that, and I'm loving doing the assessment for that as well. I think the research methods module has also been very helpful for me as someone who did not come from a research background, to kind of sit there and look at the different ways that we can kind of do research and how we can kind of do creative research was something that really interested me. And yeah, just kind of coming here and meeting a lot of other people from lots of other different backgrounds and kind of having the opportunity to speak. I know that we've got some people from medical backgrounds on the course as well, so I think that's been really interesting for me to kind of be able to speak to and learn from my peers and kind of find a community of other arts and health people who have a wide variety of experiences, and be able to learn from them as well as learning from the teaching team as well.
I realize it's early days with the dissertation, but is there anything you can tell us about the dissertation project and the direction that's going, and what you're hoping to do and who you'll be working with?
Yeah, you can. It is very early days, but I'm going to be working with the V&A, doing a cognitive stimulation therapy involving museum object handling with people living with dementia. And I'm going to be going in, and I think we're hoping to be gathering qualitative data from the participants and their carers or families to kind of look at the perceived benefits of doing cognitive stimulation therapy out in the community, and how kind of the different parties involved kind of see and perceive the wellbeing elements of that. I think that's kind of what we're planning on doing.
Mm-hmm. It sounds exciting.
Yeah, really exciting, and really great that kind of real world examples of organisations who are delivering programmes out there in the community, wanting to understand their practice. And we know from the evidence base that's really important to gather that evidence, isn't it?